Thank you, and I want to thank everybody for being so patient. My travels were not simple. So I'm going to predominantly talk about, and I thought I had my slides up, but they're up, okay. So I'm going to talk about RareX, which is our natural history study. So this room is full of a lot of different people that have lots of different homocystinurias. So what do we talk about when we talk about homocystinurias? Well, we've spent this entire meeting talking about homocystinurias, but homocystinurias aren't just cystathionine beta synthase, they aren't just the cobalamines, they aren't just the remethylation disorders. So this is just a way to think about this pathway. So when you're thinking about homocystinurias, there's slightly different things that we do for different people, but the end product is an elevation in homocysteine in the blood. And I promised I'd talk about this slide because I think it's really important. Now, in the box, that's CBS deficiency. And I always think of CBS deficiency as being trapped within the box because it gives us an idea of therapeutics. Within the circle is the remethylation disorders. And so this is what I was going to talk about for a second. So that particular circle is remethylation. It's dependent on folate and B12. And so we do know that individuals with cystathionine beta synthase have problems with getting stuck within that cycle and burning through folate and B12 really fast. And so if you have CBS deficiency, you are more likely than the average person to have B12 deficiency and folate deficiency. We think this is probably also the case in the cobalamines being more likely to have a folate deficiency. And clearly, if you're one of the remethylation disorders, we're giving you some form of folate and we're giving you some form of B12. In hopes of making that cycle work better. So in addition to what we're talking about in terms of B12 deficiency, we do know that individuals who have CBS deficiency are more likely to have B12 and folate deficiency. And this is part of the reasons why supplementing folate and B12 is part of the guidelines for CBS deficiency. We can talk a little bit different about the cobalamine processing stuff and the MTHFRs because there's a slightly different form of folate that you would typically use. All right, so I know you've heard a lot about natural history studies. And I want to talk a little bit about our natural history study, the RareX one, but I also want to put this in context of what are the other kinds of natural history studies that we have. So one of the kinds of natural history studies that we have are deep dive studies. This is the NIH study. It has a few patients with lots and lots of information about those patients. Now I grant, NIH has a lot of patients, they have more than 300, but in the big realm of things, that's a deep dive study. Now, you can also look at a lot of patients and look a little less deeply, and have the providers put in this stuff. This is EHOD, this is the European Network and Registry for Homocystinurias and other related disorders. So that's EHOD. Then we have our study, the RareX study. So this is the homocystinuria, in which what we really want to know is what's important to you. And the way that we do this is you put your information in. And the way that RareX really works is you get a series of questionnaires. So you do a cover questionnaire, and then you answer the rest of these questionnaires. So this really kind of focuses on what's most important to you, because if you may have a questionnaire that says you need to fill out the dental questionnaire, yet if it's not important to you, you're not going to spend your time doing this. And that's one of the ways. One of the disadvantages with that is we don't get quite the same breadth. And I may have hinted, there may be another one, time will tell. We'll see if we get funded. Okay, so why do we care about natural history studies? What makes this really important? So natural history studies are what informs providers such as me on what we should expect, how to screen, how to treat, but they also advance treatments. So this is talking about a biochemical and clinical phenotype with individuals with CBS deficiency. It also tells us like early identification by newborn screening improves outcomes. This is where you get that data. And notice I said, oh yeah, if you get carrier screening and we know that we can treat somebody from a neonatal period, they do better. This is one of the pieces of data that provides that information. So let's talk about the RareX and the HCU Network America. This is a questionnaire natural history-based natural history study. How many of you guys have done your questionnaires? How many of you have at least started your questionnaires? Okay. The patient or their caregiver fill it out. Depending on the screening questionnaire, depends on how long it's going to take you to fill out all the questionnaires. So if the screening questionnaire is negative, you don't get questions about certain stuff. And that's going to be important when I start talking about the data poll that we did in May. So you may have looked at the posters. There's actually there's a data poll out in the hallway. This is the updated data poll. We are going to request that you update your information annually because as individuals get older, because we all do, things about you change. And we want to know that. So if you want to find kind of time course, please note this is an IRB approved protocol. So you're consenting to do this. This is a research protocol. The platform questionnaires, because sometimes you might say, why are they asking this question, are standard across multiple rare diseases in hopes that at some point we can start doing crosstalk among different types of disorders. So not just comparing the homocystinurias to other homocystiniurias, but also thinking about, can we compare some of the issues in homocystinuria to PKU? Can we compare some of the homocystinuria answers to some of the mucopolysaccharidoses? Can we compare some of the homocystinuria disorders to the urea cycle? So the questionnaires are the same across. And this is really important. Data can be provided to academic researchers for free. So I am a certified academic researcher. I can ask for a data poll and I get it for free. All right? That doesn't, sorry, Sire, are you someplace around here? You can't get my data. You can't get the data for free, but I can get the data for free. All right. So the CBS disorders and the remethylation disorders, who, what, anything else. So this is the classic picture, and we have to thank Danae for building this picture. It is awesome. I like to use it in all my talks now. And what part of the reason we're doing RareX is like, who gets which complication? Does it different than what we draw from all the textbooks? What is the complication? How old? And then the big kicker is there anything else that we just haven't noticed that's so common? So what have our results been? So this is the data poll from May 31st, 2024. There's a total of 100 individuals who started any part of the questionnaires. There are approximately 72 who have CBS deficiency, and then we have CBS deficiency and not CBS deficiency as part of our polls, in part because we start getting really small numbers in the not CBS deficiency. Not every person answered every questionnaire. So when you start seeing an N equals, that means that not everybody has seen every single questionnaire. And this is the top kind of answers. So these are the questionnaires that were completed with greater than a certain percentage. And these are the things that rose to the top. And I'm sorry, I don't have the highest at the top and the lowest at the bottom. But this kind of gives you an idea of what we're talking about. And it also tells us what questionnaires you guys filled out. Not necessarily what questionnaires you were requested to fill out. So if you think that you're like, oh, I think this is really important, and you didn't fill out the questionnaire, I don't know you think that's really important, or that there's something important there. This is also like the percentage of responders who said yes. So at the top of this is eyes and vision. In blue is the CBS classicals. In the yellow is everybody else. And then you can see with some of the top responders. So eyes and vision is probably the highest percentage. Brain nervous system is higher in the non-CBSs than the CBSs. Behavior psychiatric, that's actually a much higher percentage that's in the literature. It's higher than EHOD. It's about 2 times EHOD. Bones and cartilage, you can see CBS is more than others. Sleep actually scored fairly highly on this questionnaire of people saying, yes, I have trouble with sleep. Digestive, now there is no data about digestive complications in the literature for the cobalamin disorders, for the remethylation disorders, or for CBS, yet this is a thing that's really important to patients. And this is like very high on our questionnaire. And this is what differs from the data. Because I know, because I've talked to you, feeding is an issue, yet, you know, you look at the reports, it's not what gets reported. All right, so I'm going to give you a second to look all the way through here. Just to kind of figure out your favorite group. And this is not everything, this is just kind of some of the higher percentages. But I'd like to point out there are differences. Eyes and vision, there's absolutely differences between CBS and the non-CBS. Developmental issues, big non-CBS versus CBS kind of thing. Loss of skills regression. This is going to be our remethylations and our cobalamin processing. And then kidney, bleeding genitals, it's kind of a general thing. Again, we're seeing a bunch of stuff in our remethylation and cobalamin processing. These are some things that really struck me because this is not stuff that we talk about in the literature a lot. Sleep and digestion is really high. The kidney, bladder, hormones, and endocrine. I don't think anyone's really looked at that a lot. We do have a nice cohort of pregnancy, delivery, and birth things. And then the cancers. Again, this is not well described in the literature. So these are the top symptoms for the classical homocystinuric group identified. And right at the top, and particularly with eyes, right at the top is nearsightedness, and towards the end is the flexible joints. This ranking differs for the remethylation and cobalamines. But you can kind of see this is the remethylations, abnormal muscle functions right at the top. Coordination issues, you can see this is very different. And this just tells us we have many different phenotypes with the different disorders. Our commonality is homocystinuria. But when you start thinking about, okay, what's the best way to start treating folks, you cannot group them together. And so as we think about doing natural history studies, really being aware of the group we're looking at and what's important. All right, now I'm going to talk a little bit about the quality of life stuff. And this is a pediatric. So this is not the adults that are getting asked. This is pediatric. So this is either children less than 18 who can answer the questions or their caregiver. So some really important takeaways before we look at the numbers. 68% felt accepted by other kids always or often. Nervous system or nervous anxiety. 25% were oftenly impacted, 38% rarely or never. Worried about having a decompensation. It's just worried is what the question is. 25% often, 44% never or rarely. And this is the kids. Worried at home, 69%. Tired easily, 69% never or rarely, 6% often. Being tired made it hard to keep up with schoolwork. 63% said never. Other kids want to be my friends. 44% had always and often, and 6% had rare. And I think this is really good news, because I was pleasantly surprised by some of these results. So let's look at this. This is what you would say about your health, all right? And so what would you say about your health compared to, and this is comparing to your age, I think. Yeah, rate your health 1 year ago. So it's comparing your health now and 1 year ago. And I think that we see a lot of excellence and we see a lot of good. And then we see that this is actually a pretty good ranking. There are very few people that rank their health poor, which I found interesting. This is quality of life and looking at subdomains. And the reason I chose to do subdomains here is because it gets really complicated when you're talking about like social interaction, positive emotions, negative emotions, leisure and outdoors, independence, total quality of life, total expectations. So in general, the quality of life stuff, really positive emotions, so smiles is happy, and the negative emotions, less unsettled and aggressive. So that's what negative emotions are. And so in general, you can pick out where the lows and the highs. The top score is 100%. The lower you are is the lower you're scoring on that, which gets complicated because positive emotions are high scored, so that means that lots of people said they had positive emotions. And then this is, during the past 4 weeks, did anything interfere with your normal social activities? And again, we're seeing slightly as the biggest group and extremely as the smallest group. And it's about the same percentage. I cannot tell you if the individuals who said that their health was greatly impacted or was poor was the same group of individuals that said this, because that's not how the data polls work. This is pain in the past 4 weeks, and then this is pain in the past 4 weeks, and then did it change what you're going to do? This is overall health questionnaires. So remembering that this is everybody, we just did all the quality of life, this is everybody. Patient seems to get sick a little easier than other people. It looks pretty evenly across the board. Patient expects their health to get worse is mostly true. Patient's health is excellent is also mostly true. And then patient is as healthy as anybody else. And we see don't know as potentially one of the biggest groups. Pain interference to normal work in the last 4 weeks. And it's interesting here because this is where we actually get a lot more pain interesting things. Because did it interfere with your normal work? And we actually see a little bit more pain reported as interference than pain impacting your life, which I found was interesting because you're really thinking about what's the impact of having pain, not necessarily what pain is. And then this is sleep. So as I said, sleep scored really high. And above the line is significantly impacted and below the line is not. And you can see the other homocystinurias, so remethylation and copolamines, they have more folks that are reporting significant sleep interruption than other folks. And this is just another way to look at sleep. And we can see that reflection when we're looking at everything. All right, this is our common prescriptions, and you'll see I'm actually doing the over-the-counter, and I'm going to do the over-the-counter and the prescription group. There's a bunch of drugs that are overlapped as being prescription drugs and being over-the-counters. You can imagine this is like B12, this is like folate, this is like betaine or cystidane, but you can also do kind of comparisons across the way according to what the reports are. It's interesting, the CBS deficiency folks, one of their common prescription is B12. It's interesting, the other homocystinurias actually reported as hydroxycobalamin. I know that Irini is really happy to see that difference. And you can see how these things kind of match the guidelines. I also found it interesting, one of the more common prescriptions in CBS deficiency is actually a muscle relaxant. It was not anything I was expecting to see, but it is. And then Synthroid for thyroid disease. The only question there is that outside the proportion you would see in a population of the same size? This is the number of people that are using diet as a treatment. And the question is diet. It's not anything more specific than that. And most folks with classical homocystinuria or CBS deficiency do use diet, which is what we would expect. And then approximately 30%. As I said, this doesn't actually tell you exactly what we're talking about when we're using diet, but it does ask, are you prescribed a diet? All right. That is the Rare X stuff. But I thought I'd also throw this one in. You got a questionnaire from REDCap about 8 weeks ago. What was that all about? So NIH has made a call for proposals for the new rare disease consortia. The proposals are all due August 13th. Each proposal needs to address concerns of the community and is associated with a patient advocacy group. Dr. Baker is in charge of the one we're doing with HCU Network America. Each proposal must have a natural history component. That's why I'm like, there may be another one. But this is going to be designed a little bit differently than what we're getting out of the questionnaires. But let me tell you, the questionnaires that you received as REDCap and the questionnaires that you've answered in Rare X are both impacting the way that we write this. Each proposal should have some disease-specific research proposals. We do not have to tell exactly what they are. So if there's something that you want us to ask, we have some ideas of some things out of the questionnaire that we thought was going to be really important. And currently we're in the midst of writing it. It's about a 184-page document. And so if you have anything you want us to include, and it's a number of you, we can certainly try to make that work. It must include a natural history and registry. It must include input from the community. Heads up, copolamine C is likely to find it in, so there are several proposals going in for inborn errors in metabolism. Copolamine C is one of the major disorders that's included in the organic acid proposal coming out of Baylor, whereas the remaining of the copolamines will probably be put in here. What we want to make sure is that copolamine C gets included, and if the other proposal doesn't get funded, we'll take copolamine C within this one. We also want to make sure that you get coverage for all the sites. So if you're outside the sites for the organic acid proposal, we might be able to pull you into this proposal, and we're walking a very fine line of what we do with copolamine C. All right, that was lots of stuff. Let's hear your questions.
We have about 5 minutes, so we could probably take 1 or 2 questions.
Did you fill out your questionnaires?
Yeah. So currently, I can give you a little bit of an update since this poll. We have 103 patients from 36 U.S. states and 20 countries around the globe. So
there are multiple language answers too.
Yes, it is pretty phenomenal to think that there's a little story here I'll add to you guys. There's a family in Ukraine who continually reaches out, and the dad reached out and profusely apologized despite bombing happening in a city that he hadn't joined Rare X. And I said to myself, well, if he can make time despite a war raging in his own city, I can make time in my life. I have far less overwhelming things than that going on. So there are people literally around the globe, even with so much chaos going on, still making the time. So please, it takes about the same amount of time to go through the Starbucks drive-through or Dunkin' Donuts drive-through as it does to open your account. And you can stop in the middle of a survey, come back to it. It's really easy to honestly, because it's all about you and your children. You know what they've done, have gone through. So,
and as I said, there's some things on Rare X that that really got highlighted that are not in the guidelines currently. We gotta just all be tired.
Oh, here, we have a question.
Okay, so academic researchers get this information for free. Are there any options for industry partners to access this information?
We'll have to chat. It gets a little bit more complicated. So you can't see the same things I can see. How's that for an answer?
Yeah. They do have access though. And one of the things to let all patients and caregivers know, so you can decide who you share that data with. You can share it with just HCU Network America, just industry, just researchers like Kim. You can decide who has access. We really encourage you to give everyone access. I mean, I would like to think that HCU Network America can do everything, but we can't. We need people like Kim. We need companies like Travere and Cintas and all these other companies that are coming up online to be able to have access. The more you give to them, the more we get back as a community. So it will really help accelerate things. And Kim's already published a paper which we shared, so the data's already making a difference.
Yeah, we didn't put the teeth paper up.
It was in a thing yesterday.
Was it?
Yeah.
I know Danae wants to close, but I want to say something that she won't say. Danae is a rock star. How many of you were here at the meeting in Denver that the University of Colorado helped us put together in 2011? Raise your hands.
I have a picture for everyone.
Okay, so there was about 10 of us here. And it was the first ever meeting in the U.S. for patients with at least classical HCU. And out of that meeting, we had an initial effort, let's organize, let's do something. And the person who took the lead ended up having some issues in her family, and we didn't come together. And then Danae and I both attended a meeting in Prague that HCU Network Australia coordinated. Kim was there, that's when I met Kim. And Danae was like, let's do it, I'm ready to help you. And so Danae and I did everything it took to get this organization set up. And then I made a great decision. I'm going to hire Danae because we need someone to work on this. So I convinced her 20 hours a week. Tell your mother who she was working for in her violin shop, you'll still do great work in 20 hours. We need the other 20. Well, it didn't take long to see we needed 40. And we get a lot more than 40 hours from Danae. And now we've got other people like Liz and others helping us. But when I think about what we saw over the past 2 days, what has been accomplished, what has been accomplished in terms of just providing all of the supportive information to families, not only classical, but expanding to cover all homocystinurias. When I think about what's been accomplished in newborn screening, Carla said it, this wouldn't have happened without Danae. When I think of what's been accomplished on the research front and all of these programs we heard about and everything Danae and now Liz helping with social media, everything they're able to get out there, this is just unbelievable, Danae. I couldn't be prouder, and we all appreciate you.
So, Brad, I have a lovely little picture I want to share. So, and then I have some slides too, but I thought I would share this because it's kind of cute. So, this is a little tiny group of patients that were here about 14 years ago. And it's a very pixelated because the picture quality in 2011 wasn't great. And it's pretty awesome because there's quite a few of those families that were there that are here today. And it's really amazing to think how things have evolved. Our first official HCU Network America conference was in 2018 in just outside of Boston. I'll say that, but it really was like an hour. Sorry, families. It was rough. And so it's amazing to think how things have grown. We didn't have any Bowen families in our fold at that time. Adam, who everyone probably met because he's our little social butterfly ambassador. He was our first patient to join us in 2019, and then it quickly expanded last year when we combined with, not last year, 2022 with the Organic Acidemia Association, and then this year with just our organization. I mean, we couldn't even really fit in the lobby. So I could have never dreamed of this. When Margie approached me, I thought it was just going to be like, I was running the PK organization a long way, and I'm like, oh, it's going to just be like this little hobby thing. I'll be okay. If only I knew. So, but I wanted just to share a few things here from that I think there's so much that has happened. When we were here in 2011, Jan Kraus and Ken McLean presented. Jan Kraus's work was just a mouse model. It's now in phase 3. It is, it seemed like a dream then. It's so much more of a dream now, and it's becoming our reality. And we really need patients to come on board. Sorry, I'm trying to get my correct thing here. Hold on 1 second. Got to get back into presenter mode. All right. So there's a lot of ways you as patients and caregivers can participate. As Kim just shared, we have our HCU Data Collection Program powered by RareX. In your folders, there is a flyer that talks about that. We really would love to see every state in the US covered. We are really close. There may only be one patient, but I am determined we will find someone in every state. And I will probably hassle them and track them down, because that's what I do. There are natural history studies happening. The NIH has one for cobalamin disorders, and Travere has one sponsored for classical homocystinuria. So if you don't qualify for a clinical trial, those are great opportunities. We learn so much. As an aging population of patients, we don't know what's happening to us, even for families with younger kids. Because of newborn screening, our futures are looking so different than the generations before us. Treatments are different. And Irene showed just with high-dose hydroxycobalamin how different the patients' lives are becoming. We need active, engaged participants in research if we are going to know really what our lives look like with a standard of treatment currently and what it's going to look like down the road. So I highly encourage you to participate. It's really not that much time. And they usually, with NIH, there's housing assistance while you're there, and the Travere one can actually come to you. So there's options. Clinical trials, we've heard a lot about different things going on, and then there's also market research things. We do share those out as an organization. Those definitely get sent back to the different companies, and that feedback is critical to making sure that the stuff that they are developing is in mind with you. And I didn't have a slide on this, but I should have. We had our ELPFDD, which is an externally led, patient-focused drug development meeting. I was going to have a whole thing for that. Whoops. And can I ask, yeah, but first I wanted to say, if you recorded, took part in a panel, or helped plan our ELPFDD, can I ask you to stand? Because this was such a tremendous undertaking. We had, I saw Brooklyn here. There she is. Mark, you too. We had, this was an incredibly taxing meeting that also was, I can't even explain to you what it meant to be able to host. This meeting really was for the FDA. They won't let you say that, but it was. And it's changing things already. We know that when a company goes and applies for FDA approval, that our voices will be heard, they have been captured, and they have been heard. And so we can't thank families enough, and we need you to be continued to be involved. Also, I learned so much as a community leader, and I've heard also from Kim, we had breakfast the day after, and we were just kind of dumbfounded, honestly. And so you guys are teaching us. You're teaching us what's important and where we need to focus our energies and our attention. So please participate. The last thing is, if you haven't heard enough about the Race for Research and how important it is to join and participate, we are going to do one more plug here. And so these are some of the faces which you've heard about their research now at this point. Your dollars, your efforts in helping fundraise are already making a difference. And so I think Margie paved the way with, really being a leader for our community by funding research herself. And now we're able to crowdsource as a community to make research happen. It is so exciting to see things really, truly happening. Brittany and I have had a lot of heart-to-hearts about what we're going to do about hydroxycobalamin for patients. And we need these things to happen faster. We need you guys to back us up and to get things moving because patients are affected. You know that better than I do every day. I'm going to stop. But if you haven't seen the QR code, here it is. It's in your folders. On the back of the Race for Research flyers, also our research we have funded. So I really hope you will join us. And if you have any questions, Dana over here, who is our most amazing fundraiser ever. If you have participated in the Race for Research, can you stand up? Because all of you have helped make our research happen.